I'm here at Schiphol Airport and I'm speaking with Dr. Veneeth Sidharthan. He just makes a stopover from a seminar in Spain where he did live cases, and I like to take advantage of this opportunity to have an interview with you.
Thank you, Rani. Thank you for the time.
So what is this seminar you're doing there in Spain?
Okay. In Spain, we are doing, basically we are doing the workshops. It's not a seminar because I've been doing like this since last 2 years. And there we are having the live patients. They are taking the patient. The organizers are taking patients there. I will take the case and we will prescribe the medicine. And I'm going to Spain like 3 times a year. Whenever I'm going back, I will get the follow-ups. We can see what happens with the homeopathy. That's the thing what we are doing. We are not giving the philosophy and all. We take the case. After that we will give a 1.5 hours or 2 hours break. So at that time we will discuss regarding the case, and I will advise them what to take and what not to take. So we will take the symptoms of the patients, and then we will do the repertorization together. We will discuss together, and they will have their questions and they will have their queries regarding what to take and not to take. Repertorization is like garbage in and garbage out. What you are giving inside, you are getting the results, right? So what to take, that's very important. So we will take what the patient says to us, and sometimes we will ask their the parents or their friends or their spouse to tell that that's very important in homeopathy regarding the objective studies. And after that we will repertorize and we will give the medicine. Till the next time when I'm going there, in between we will have the follow-ups through the WhatsApp and all. So we will check whether the patient is going good or not, and we have a lot of results there in Spain. Especially the people they are promoting homeopathy there, because the patients, they are getting the results and they are promoting homeopathy. Because I will tell you one example of a lady. She is only 36 years old, and she got she was getting the fibroids, uterine fibroids, and she has to go for surgery 3 times in half month. Like in 6 months she has to be done 3 surgeries. So it's like 6 surgeries in a year. So she came to us and we treated her. I think since 1 year we are treating her, and previously it was not good, because even though we are giving medicine and she went for not 3 but 2, it reduced to 2. But this year, from January to now it's October, she did not go for the surgery. And she went for the gynecologist, and she told that the gynecologist told that her tumor is not growing. That is what we are doing there. That is the workshop what we meant. Not we are not giving the. I am not giving the philosophy and all, because all the people in the Spain, they are medical doctors and they are into homeopathy maybe like 20 years, 30 years like that. They have done so many systems, everything they have done, but it was not working, and they were actually disappointed regarding homeopathy. And they said to me that they treated a lot of patients and they lost a lot of patients like that. But now this is increasing, the number of patients increasing when I'm going there, and even they can able to reciprocate. That is what I'm believing in homeopathy, because what I'm doing, that could be reciprocated. That is the science. Yeah. That's things what going on in Spain. Yeah.
Okay. People who do not know you yet, who have not followed your seminar, you have done, for example, 2 seminars in the Netherlands the last 2 years.
Yeah.
People who do not know you, what kind of homeopathy are you doing? So I feel a little bit foolish, because when I was trained there was only one method in homeopathy, but that's why I still ask you, what kind of homeopathy are you doing?
I believe there is only one kind of homeopathy is there, because it's Hahnemannian method. Because Hahnemann found homeopathy. He has done all the principles, all the things what to do and what not to do, and I'm only following that. Because Hahnemann, after finding out homeopathy, he took 12 years away from everything to rot the chronic diseases. 12 years. He was a medical doctor, he was a homeopath, he has got a lot of patients. Then he took 12 years to rot chronic disease. So that's very important. In India, I am looking more than 60 patients a day, more than 60 patients a day. And I'm just following his principles because, everything depends upon the principles formulated by Hanuman. We don't have to go behind what the patient thinks, what the delusion, what the things. No, it's purely similia similibus curantur. What the patient is having, the inner core, we have to find out that. That's the patient will tell you, because if you have a problem and if you want to get rid of that problem, normally you will tell the things, right? You will tell, I have this problem, doctor, I have these things and I have all these things. You have to take that, that's all. You have to take the emotional symptoms, you have to take the physical symptom, you have to take the specific symptoms, and you have to find a particular medicine for that. That is a similimum, what the patient telling to you, and you have to find the similimum. That's all. And I found in my practice, that is like I'm looking more than 60 patients a day, I found that a 90% of cases we can cure with the classical remedies. Actually, the Hanumanian remedies, like Hanuman found out more than 99, I don't know, maybe 99 remedies he found. So maybe 150 remedies, you can solve the problems, 95% of the problems. And the 5% there will be we can't able to see the patient because of we can't able to recognize, or we can't able to know how the patient is. That is not the problem with the homeopathy. That's the problem with the doctor. Yeah.
Or the cases may be incurable.
Yes, there are some cases incurable because of the medicines, because of the vaccines, But even though even though you took a vaccine, right, and you are showing some symptoms, that is your vitality. Everybody is not having the problem with the COVID vaccine. Why? Some people are getting cerebrovascular accidents, some people are getting stroke, some people are getting multiple sclerosis. Not everybody is getting, because their vitality is responding to that particular stimuli in a particular manner. So we have to get the symptoms from the patient. Not we have to give a medicine for the vaccine. Okay, you have took the COVID vaccine. I will give the Covishield. We have medicine from Covishield, I know. Potentized. No, it's not useful because it's isopathy. It's not homeopathy. Homeopathy is what your body is responding to a particular thing. And we have to collect that symptom, and that collectively taken symptom is given to the repetition, and we will get a medicine that will works. Otherwise, I think it won't work otherwise. We have a lot of patients in India also, because somebody was telling me when I was taking classes in Europe, somebody was telling me that in Europe the things are different because the people are complex like that. No, it's in India also. Now India is like a metropolitan city. India also, the people are changing. We have a lot of problems there with the emotional and the physical and mental levels. So it's same now every day. That's the thing.
I hear this argument often that people say now we have new diseases, autoimmune diseases or whatever, and we need new remedies. So that you cannot cure. So you cannot cure them with like I know in Clark are 975 I think remedies, and they say those are not enough. You need new remedies.
That's absolutely rubbish, because I will tell you, we have a new example. Because in 2020 when we got struck with the COVID, what happened? COVID is a new disease, right? And I got patients from the Spain, because I was taking classes in the Spain. So in 2020 March, the first case of COVID I got from Spain. She was 87 years old woman, and she was not able to go to the hospital, because as you know, at that time the old patients were not taking to the hospital because the hospitals was full. So we took the case because she was the mother of my friend. So it was a new disease. I was also looking forward for a new disease, but you need only symptoms. We got the symptoms. I got the symptoms of camphor, and I gave the camphor, and she was good within 1 week. That's homeopathy. the new diseases are not a problem. We are not treating the disease. Basically, Hahnemann said, basically the principle of homeopathy is like that. We are not treating the disease. We are treating the person who is having disease.
Who shows the symptoms.
Yeah, that's all.
Yeah.
So every stimulus, whatever disease, whatever the physical things, whatever the material things, whatever the vaccines, whatever things which gets into your body and what you are throwing up, that is important. We are treating that because that is simply a similar curator. We don't have to go for the, oh, it's a new disease, what we do. No. It's like we are treating the individual. That is absurd actually. What homeopath says that we don't have new medicine. We require new medicine for the new disease. No, because according to homeopathy, we are treating only individuals, not the disease. That's clear. Then why we are going behind the new medicines and new things which are not even proven. Not even proven, homeopathically, not scientifically, I would say. Homeopathically, it's not proven. Yeah.
You mentioned something before that you need the core of the patient. What do you mean with you need the core symptoms of the patient? Because is that the core delusion or what is that?
Yeah, no. It's not delusion. It's the core means. I will tell you an example. If you are very healthy, okay, you are healthy, physically healthy, and everything is with you. You have muscles and you are tall and you are stout and very good. But if your mind is not working, you are an idiotic. What is the use of that? You are not specifically can do something. Okay? But if you don't have two hands, you don't have two legs, and your mind is working, you can survive, right? That is the importance of the core. Your core depends upon your what we call as the mind symptoms, mind emotions, and the what is your will, what you have the intention, your intelligence. That's very important, right? That is the core. That is why homeopathy give importance. If you go for the repertory, if you go for the intelligence, you will find a lot of remedies, like more than 25 remedies, right? And if you go for idiotic, you can find a lot of remedies like Baraita, Carbonica, and a lot of like that. So, what makes a man, what makes a person, that's very important. How he can survive, that's very important. If the person is having physical strength, if he doesn't have any, the mental faculty, how could he have to survive?
But do you mean only the mental symptoms? Because you said you need to go for the core.
Yeah, the core is like what a person is consisting of. That's very important, because if you take a remedy, if you think in sense of a remedy, what a sulfur patient does. A sulfur patient is he may be intelligent, but he is lazy. He's lazy. But what a lycopodium patient, he is very intelligent, but he's a coward. Okay, that's why the patients, that's why the individuals are, they have the outer thing is like that. We have to find what is hiding inside. The person will show up something else. So for that, the very important thing is you have to go for the objective analysis. You have to know whether the patient is a saint or a hypocrite. That's very important.
But I think this might be a little misleading, because I saw your cases and you're looking at the totality of the patient, and then you're selecting the most characteristic symptoms from that. So the core is not only the mind.
Yeah, it's not only mind. It's the sum total of everything. Because I will tell you, if both of you are drenched in rain. Okay, we go out and we drenched in rain. Maybe I will get the fever, you won't get the fever. That is the core. That is the thing. Because how your body is reacting to the particular stimuli, not only the mental, not only the emotional, and not only the physical, how the body is reacting. That is very important. That is what is called individuality. That is what I am telling always. It's simple. To make it simple, because you have to know how the patient is reacting. That is what is meant by the core, because according to the core you will react to a particular stimuli. That is what we have to talk.
Individual characteristic symptoms.
Yeah.
Away from the pathology.
Yeah. There is no need for pathology, because you can take the pathology, you can consider the pathology, but the most important thing is your characteristic. Because if you are, if you are supposed to get some sort of radiological or chemical or some sort of things to you. Okay, you are exposed to that. And if you check the people who are working with the radiology department or the chemical industry or something like that, everybody is not getting the particular type of things, right? The cancers or whatever, skin diseases or whatever it is. Everybody is getting it in a different way, right? So what is the stimuli? That is not important. How our body react to the particular stimuli, that is the core. That is the core we have to take.
But last time you did a lot of skin diseases of children.
Yeah.
And then also you pointed out, and I learned a lot from that even in what I might dismiss as, this is eczema, if you observe carefully, you can still take 2 or 3 or 4 characteristic symptoms from that.
Yeah.
So you take the characteristic symptoms from all levels of the patient.
Yeah, because every children, they are different. Because when I saw, I have a lot of cases I shown last time. Because one child is clinging to the parent, clinging to the one child is very restless. So everybody is reacting differently. Mm-hmm. So we need that. That's what Simillimum, what meant by Hanuman. Mm-hmm. So basically homeopathy is very simple. I always tell, and my motto is keeping it simple, because whatever the patient is showing you, you have to take that. Mm-hmm. Why you are thinking, all other are assumptions. Assumptions are the pitfalls in homeopathy. Because when you assume something, it may not be the correct thing the patient meant. The patient would have the different feeling. And how could you able to assume that? How could I able to assume that Rene is like this and Rene is like that? No, Rene should have to tell me that I am like this. I feel like this. Then what you are feeling, I can take that. Maybe I can found a particular rubric in a repertory, and I can find that, and I can work out on that. Mm-hmm. But I can't able to assume. Okay, this is that, and this is that, and this is that. No, it's not homeopathy.
So when we walked here, I mentioned that this morning I was looking at the hypnosis video, and that those people say that 60 or maybe even 90% of all physical symptoms have a mental emotional causation. Mm-hmm. And you had a good remark about that there is not emotional or there is physical.
Yeah, it's a totality. We can't able to say that it's purely due to the emotional symptoms. See, some symptoms, when you go out, you got a rain, you got a sunburn. It's not emotional. But the chronic diseases, maybe we have to separate that acute and chronic. In chronic diseases, there is a percentage. Maybe 50% you have emotional thing which is going towards to the the totality. Mm-hmm. But everything depends upon the totality. We can't able to say that everything depends upon the emotional things. There will be a totality, because emotionally the patients will have some things. We have to take out that. What is your thinking? What is your thoughts? Like what you feel when you are there? What you feel when you are alone? Okay, but afterwards you have so many physical symptoms. Your sexuality. Everybody is different in their sexuality, right? Some people don't have the libido. Some people have the more libido, and some people regarding the sleep. So some people will sleep like anything, and regarding the food habits, regarding the weather changes, it's a totality. That's why homeopathy says that it's purely depends upon the individuality. So this everything conglomerate into an individuality. That's what we want to take out and what we want to give to the patient. Because the patients, maybe sometimes the patient won't able to recognize what they are having. In that time, we can ask them. We can ask how do you feel about this? How do you feel about that? Like that. So we will get the total symptoms and we can treat that. That's all.
You mentioned before this interaction between the psychology and the vital force. Can you explain that a bit more?
Yeah, there are so many problems regarding this, because whenever a patient is coming to us, if they are having chronic diseases, we will educate them first. You have to tell the things, otherwise we can't able to help you, because we are treating in India. We have more than 60 patients a day. You can calculate, if you give 2 hours for them, we can't able to look after them. Okay, so we will educate them. It will tell them, you have to tell the things to us. Okay, and from that only we can able to help you. So most probably they will be describing all the things, what they are having, what the feelings they are having. We have to give the specific importance, we have to go specifically. So if they started says, I got these things after this incidents, most probably they will tell like that. I got the things after the death of my friend or something like that. So there is ailments, ailments. We take that an ailment. So better, everything is written in homeopathy. The problem is what you have to ask. If you ask them specifically, you will get the answer. Normally, if I'm sitting with you, okay, Rene, I will ask you when all the problems started. So you have a specific answer, right? You will tell me, I got this time because of this. I'm haunting. I have this feeling. So I will get all the symptoms from you. It depends upon the doctor who is asking the things. Mm-hmm. Especially if the doctor is specific regarding the symptoms, and if the doctor is specific regarding what to ask, you will get the symptoms very easily. And the psychological thing will be there. I know that, because some patients, they wanted a vent, they have to give out the things. But we don't have that much time there in India, so we can't able to listen a person more than 20 minutes or 30 minutes. But we are treating the patient very nicely. We have a lot of cases. We have cancers, we have autoimmune diseases, we have new diseases. Everything is very nicely weekly. Only thing is, we have to take what is important to the patient. That is what I always meant, what is the core of the patient. Mm-hmm. That could be elicited. We have a term called elicited or precipitated. Because the patient won't tell that, because they don't know what to tell. If they are coming for the first time, they don't know what to tell to a homeopath, because that homeopath will be a new person for them. So we know what to ask them. If you ask something to them regarding specifically, we know what to ask. When did it started? Okay, did you have got some problems in the past? So it depends upon the questioning of a homeopath. Mm-hmm. So that is very important. You don't have to listen the whole time, the whole 2 hours, 3 hours like that. We don't have time for that, basically, because in India, in my place, I'm looking more than 5 to 6 cancer patients a day, new cases. So if I'm giving 2 hours for them, I can't able to look at other patients. So we have a particular protocol. The protocol is nothing. Only we ask the thing specifically. So we have a protocol like that. What to ask. When did it started, how long it affected, what is the main cause, how you feel the things, then it will come out. That's all.
So, and also important is correct analysis. So not only case that you select the correct symptoms, but also that you correctly repertorize.
Yeah.
And during your recent seminars, you gave many tips how to avoid incorrect repertorizations.
Yeah.
I often see people who have like 40, 50, 60 rubrics in a clipboard. When I do tech support, I'm looking and I get shocked. I know it has no use, but you're giving good practical tips. So probably you will be invited again to the Netherlands to give in 2024 a new seminar.
Yeah.
And you will also, what would be your focus what would on that seminar? What topic, or what would you do there?
Yeah, basically, repertorization is what we call the garbage in and garbage out. So when you repertorize, the main thing is you have to give importance to the characteristics of the patient. You don't have to take everything what patient is saying to you. So there is a common order for taking the rubrics. If you are taking rubrics from a mental or emotional thing, you have to take 2 or 3 characteristic. Don't take all the things what the patients are saying. You have to take what is specific in that patient. We can distinguish that patient from a normal other person. Likewise, everything. If you decide to take prawns, if you decide to take shellfish, you have to take that. That's very important. Some patient, I decide shellfish. When you ask them, they will tell, I decide shellfish. After that, when you ask again, okay, I will take maybe. Don't give importance to that. That is what we call the intensity of that particular rubric or particular symptom. So you will be specifically give importance to what to be taken. That is very important. That depends upon your experience, your knowledge, and everything. That we can I can explain when I am in a class, because this is like when I started to explain this, it's like 2 hours, 3 hours. I have to explain all these things, how to give intensity to the particular symptom. So giving intensity is very important. So don't take everything. I have read some during the my college times. Once Kent asked his disciples to take the keys. And the people, they wrote all the things and give to him. So Kent said, where is the case? There is no case in this, because they wrote everything like that. So that is not the case. For the case, we have to give importance to the person.
You mean they showed you the case and it was all standard symptoms?
Yeah, other normal symptoms. Normal symptoms. We have to point out which is important and which makes the patient different from other people. That is very important. It's very simple. If we together went for a dinner, okay, and obviously you will order something and I will order something. Maybe for the courtesy we will do something like similar, but you have your own likes and dislikes, right? Likewise, every individual in the world, they have got their own likes and dislikes. So we have to get that. That is the core. That is the core what I meant. Even every, for the emotional thing, the sexual thing, everything, there will be an individualization. We have to find that, and we have to find a correct remedy for that. That's all. That's why I always tell that it's simple.
So when you will be invited again in the Netherlands, what topics are you focusing on? Is it do you want to do a specific topic, or proper? It depends, of course, on who invites you. But what topics would you be doing probably?
Yeah, my topics is basic homeopathy. What is the basics? We have to be stick on the basics, because most probably every seminars I am showing my cases. I will show the cases like what I have done in that cases with the results. So how I dealt with that cases, how I got the symptoms, how I took the repertorization, how I changed into the rubrics, how the symptoms are being changed, and how much intensity I have given the rubrics, as you are working with the radar, because if you change the intensity also, you will get a different medicine. So giving intensity is also a big problem with the rubrics. So how to give importance to taking a rubrics, and how to give intensity for every rubrics. That's very important. And everything I always do the seminars or workshops in a manner that making it simple. So it should be like the participants, they would understand the thing and they could easily understand things, and it could be replicated. That's very important. I believe in that.
And the last times, you always did it in the form of a workshop.
Yeah.
So you always present the cases, you give some time to the audience, and it's not a lot of time after work.
Yeah.
And then you discuss together, and you show the results always. What I remember is almost all cases you've shown, like, it depends on what type of disease, of course, but like after a few days, after a few weeks, after a half year. So everything is documented, how the remedy acted.
Yeah, without the results, we can, even though the results, it's cured or it's aggravated or it's not cured, it's very important. If you give a medicine, you are getting the results from the patient. So that's why I am doing the workshop, because I just wanted the people to know how to do with this. Because when I am giving the the worksheets to them, they will try to repertorize, they will get the remedy, and they will see that, oh, I am giving this remedy to the guy and this guy is getting cured. So that's very important. So if they are able to get the same medicine what I have given to them, that's very good, because they will get the confidence that if a person like that come to them, they can treat them. Yeah? So that's what I am doing, because this is a science. Homeopathy is a science. I believe the science should be replicated everywhere in the world. If I can do it in India, it could be replicated everywhere, Netherlands, Spain, or wherever in the world. And it should be on easily comprehensible principles. It's be written by not me, it's by Hahnemann. Easily comprehensible principles.